Today, Dr. Walker and I are discussing the recent findings of a major U.S. task force on mental health in children and adolescents in 2022. The task force has, for the first time ever, issued a recommendation that all children between the ages of 8 to 18 be screened for anxiety disorders. Dr. Walker, as we discussed earlier, this was alarming for a lot of parents, and I imagine for pediatricians as well who aren't prepared. It seems like a very dramatic statement and has left a lot of people wondering, what do I look for? What should I be thinking about? So I'm wondering if you can help us understand. 8 to 18 seems like a very broad range. So what should someone look for in a child, let's say 8 to 12, right? And then how do we look at it for that older set? Are there differences?
Well, sure, there are differences, and they relate to kind of the developmental stages. But in younger kids, you're going to see more separation anxiety, meaning fears of being dropped off and maybe not being picked up. You're going to see more clingy behavior, maybe extreme shyness. You're going to see more argumentative behavior sometimes. If a kid is afraid to go do something, they might argue with their parents. You might see a kid taking an extraordinarily long amount of time to do things that other kids, like getting dressed or leaving the house. You might see a kid asking you over and over again the same questions. Like, Mommy, do you hear that siren? Where do you think it's going? Where do you think it's going? So in a little kid, you might see things like that. In adolescence, you will likely see, social anxiety is the most common anxiety disorder that teens and adolescents face. And social anxiety is a pretty extreme fear of being judged negatively by others. And of course it makes sense because teenagers are becoming, their peer groups are becoming very important, and what other people think of them matters, and they finally realize it. So situations at school where they're going to have to give oral reports might be real triggers, and parents might notice that their kids tell them that they're going to do horribly or that they can't do it. Or kids may not want to take certain classes if there's teachers that intimidate them. And teenagers are likely to probably isolate a lot more and not be forthright with you because they realize that their fears are a little bit irrational.
So at what point, there's obviously some distinct behaviors, and I think as parents we've all used the terminology phase. Oh, they're going through a phase. At what point do we have to start to consider this as something more serious than a phase or just annoying behavior?
Right. Well, the interesting thing about anxiety disorders is that they naturally wax and wane. They come and they go. Some weeks are better than others, days, months, years. And sometimes that confuses people and they think, oh, well, it's a phase. But, those of us who practice in this area, we know that a disorder is diagnosed when the problem causes a lot of distress, the 4 Ds, a lot of distress, that it disrupts the child or adolescent's normal functioning, either psychosocially or otherwise. It lasts, it waxes and wanes for longer than 6 months. And those are the things that make an anxiety problem significant enough to be considered a disorder.
When you start to see these 4 Ds, right, when it starts to sort of present its own case, how does a parent confront the child? And I don't even like using the word confront, right? How do you approach them and start to have a conversation about seeking help as a family, or in the case of a teenager, maybe encouraging them to do so individually? Like what is the right approach?
Right. Well, first of all, don't be afraid to discuss it with your child. Parents are often mistakenly believe that if they talk about something with their kids, it's going to make it happen to them. That's not the case. So adopt an attitude of curiosity. If you notice that a child's fears are getting in the way of their being able to do stuff that they really want to do, you can sort of say, hey, I noticed that that you didn't go to this pizza party, even though I know you were really excited to. I wonder what's going on. A lot of kids have these kinds of worries. So to normalize it and to be curious and be absolutely open and willing to talk to them about it.
What if your child rebuffs you? I'm imagining again with a teenager who, I like what you said, they're starting to feel that their fears aren't typical or usual. So if they rebuff you, how do you keep engaging in the conversation? You just kind of, is it persistence?
Well, one thing I know about teenagers is the timing is everything, right? And with kids, it's the same. I mean, if you say it once and they rebuff you, well, just let it rest a little, let it sink in. And the next time it comes up, bring it up again, not in a demanding way, but in a curious way. And usually kids will then recognize that you just want to help them, that you aren't trying to stigmatize them or tell them there's something wrong with them, that you see that they're suffering and that lots of kids suffer. Many kids really like hearing that, and they also like to know that there's effective help. So if you can have that attitude that you're going to help them feel better by talking about this, that would be a good start.
So I'm thinking of sort of a checklist in my own head, right? So observe, right? Then I see some level of persistence in what I'm assuming is a problem. Is there a third step, Dr. Walker? Do you recommend checking with teachers or friends' parents to confirm that they're noticing something?
Absolutely, and in fact, when you have your parent-teacher conferences, right, oftentimes teachers, for example, of kids with social anxiety, they'll report that the child isn't, engaging in class participation enough. Well, the thing not to do is to go to your kid and say, Ralph, why aren't you raising your hand? It's to say, wow, I noticed that, you're not raising your hand. Does that make you uncomfortable? Absolutely. Information, I'm not sure about other parents, but in your child's surroundings, you'll start to notice that maybe your child isn't able to do all the same things with ease that maybe other children do.
And then the last thing you said was children and teenagers will feel relief to know that possibly there's treatment. So before you have the conversation, do you recommend looking for resources?
Again, I think a parent's best asset is to educate themselves. And there are a lot of resources on my website, which themselves give you a lot of resources. And to not stigmatize a kid, but to say, we all have different kinds of anxieties. Maybe you're dealing with some of this. People know how to help kids with this, kids and teenagers, and it's no big deal because it really isn't. And to just be supportive and tell them that there's effective help.
Terrific. And at which point then you can collectively agree on next steps or a protocol.
Right. I mean, probably as the parent, you'd try and identify a clinician who is trained to deal with these issues. And then you would talk to that clinician. And every child is different. And I often get the question, well, Fred isn't going to want to come in. What should I say? And usually I'll say what I just said to you. Tell them that you've noticed that you feel uncomfortable. And this is a doctor who can help you feel more comfortable in these situations. Whatever it is that you pick up on in terms of your kids, it's sort of a point that might motivate them. And it usually is that kids want to do things, but their fears prevent them from doing things.
Fantastic. All right, very clear. Thank you so much.
My pleasure.